Good afternoon and welcome, everybody. I'm Kim McGrail, and I'm Director of Research at UBC Health and a professor in the School of Population and Public Health in the Faculty of Medicine. Thank you for joining us today for our next session in the Health After 2020 dialogue series. Before we start, I'd like to acknowledge that UBC Vancouver Point Grey campus is located on a traditional, ancestral, and unceded territory of the Musqueam people. And the Okanagan campus is located on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. I'd also like to recognize that UBC's activities take place in community on the unceded, ceded, and traditional territories of 203 First Nations and 38 Métis chartered communities, each possessing their own unique traditions and history on the land referred to as British Columbia. Today, I'm joining you specifically from the traditional, ancestral, and unceded territory of the Coast Salish people, the Squamish, Tsleil-Waututh, and Musqueam nations. So before introducing our speakers, I'd like to make a few comments about UBC Health and the Health After 2020 program. UBC Health works under the Office of the Vice President Health. We recognize the growing need for collaborations to address complex and interconnected problems facing society. We facilitate collaborations across disciplines, faculties, and campuses, as well as with partners, health partners, and communities. Our work enables us to improve the ways we collectively train people, develop knowledge, and shape policy. Our ultimate goal is to address inequities and improve systems that foster and support health. Through our initiatives, we aim to foster an active community of health research, practice, and mentorship. The UBC Health Dialogue Series brings together scholars, students, and community partners to discuss important topics related to the health and well-being of society and advance interdisciplinary knowledge translation. Our understanding of the determinants and experiences of health and well-being has changed. In 2020, the COVID-19 pandemic accelerated some existing trends and put a spotlight on others, and we are now responding to the broad effects of the pandemic. We have the opportunity to learn from our collective experience and to think differently about how we define and value health, how we understand the complex systems that produce health, and how we rise to the challenge of supporting equity and health across individuals, communities, and societies. In response to this opportunity, UBC Health developed Health After 2020, a program designed to support researchers to engage in interdisciplinary collaborations and build a community of UBC Health scholars. Through the development of research collaborations, academic outputs, cross-campus conversations, and open dialogue sessions, the program convenes and informs people at the inflection point in our society created by the COVID-19 pandemic. 8 interdisciplinary teams have been funded during this inaugural year to advance and disseminate their collaborative research, which includes leading a dialogue session like today. So this session today in our Health After 2020 dialogue series is titled Engaging Patients Before and After Childbirth from All Walks of Life in Health Research. The session will be led by Marianne Vidler, an assistant professor in the Department of Obstetrics and Gynecology, Faculty of Medicine at UBC. And joining Marianne is Dr. Quintala Ard, a behavioral scientist and public health professional. So please welcome Marianne to start us off.
Thank you very much for the warm introduction, and also thank you to UBC Health and the Health After 2020 program for the funding and the kind of vision of this overall program, which Kim has outlined. So we'll be talking about engaging patients before and after childbirth from all walks of life in health research. And I know Kim already did a land acknowledgement, but I just want to state that I'm joining you today from the traditional unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And I encourage you all to reflect on the lands that you're joining from. And this is just a note that the session will be recorded. And we're hoping to use this session actually to further our project and really gain some learnings. So if you would not like your identity to be disclosed in any way, feel free to turn off your camera or use a pseudonym. And we already had a great introduction, but just to say again, my name is Marianne Vidler. I'm an assistant professor and obstetric health researcher at UBC. And I'm going to be joined here by friend and colleague, Dr. Quintala Ard, who's a scientist and PhD mama. So I'm going to launch a couple of polls. This is just going to help us get a bit better understanding of who's joining us and what the perspectives we have are. Great to see quite a range of participants from researchers, clinicians, students, educators, as well as community members and patients. So that's great. Great. Actually, it's great to see that we have some participants who haven't been involved in research in the perinatal period. I think this topic, of course, our interest is in perinatal health, but I think it's definitely broader and can be applied to a number of areas. So that's great. Our last poll, which is really just to get a little bit of your insight. We're going to be talking about how we can better reach and engage the historically underrepresented populations with a focus on BC. So love to hear from participants what they think as far as which groups have been historically underrepresented in the work they've seen, participated in. Great. So clearly, I mean, I think this just highlights the importance and the need for talks and discussions like this. Lots of respondents saying really across the board in all of these groups, which clearly are not all encompassing, but that they've seen or are aware of underrepresentation. So that's perfect. Thank you so much, everyone, for participating and giving us a little more information to go on. Now I will take you through a little bit about our project. So just to start with what the problem we identified. So research participants and patient partners in patient-oriented research often do not reflect the diversity of their communities. And this can be in a number of ways. So education, income, race, ethnicity. So clearly that's a problem if we're developing research that doesn't represent the communities that we're hoping to serve and support. So the objective of this project was to try and identify a little bit around why that is. So what are the barriers? What are the barriers to engagement and participation? Hopefully some ideas about possible solutions. I think we have to be also realistic that we're not going to solve this problem within a short project, but hopefully identify at least some strategies to better diversity and inclusion in research. And for our purposes, this is specific to the pregnancy, childbirth, and postpartum period. But I think a lot of the principles can apply outside of that as well. So the way we went about doing this, and we're partway through the project now, is through an online survey. And this was to target researchers, maternal health organizations, program implementers, and community members about their perspectives and challenges. And I'll share some of our preliminary results for that. Then we're also convening 2 virtual events, one of which is this health dialogue. And also we participated in the BC Support Units Conference, Putting Patients First, where we held an interactive workshop on this topic. And Quantrilla will also be sharing the results of that event. And then finally, we have some fabulous medical students this spring who are going to be conducting some focus groups and interviews with patients or potential research participants from these historically underrepresented groups to get a bit more depth and detail on the challenges, barriers, as well as possible solutions. And the output, ultimately, we're hoping for some suggested strategies for future engagement to improve diversity of patient groups in perinatal health research. So as I mentioned, we'll start with the online survey. This is the QR code for the survey. If you are curious and you want to fill it out, we very much welcome that, or share it with anyone you know who may be interested. We can also share that after the session. So some preliminary results. This is from the first 39 participants. I looked just before this session and we had another 7 or 8 participants today. So we continue to increase. So I'll go through some of the key questions. And if you've taken the survey, or if you do, you'll note that it's actually broken into 2 sections. We look at engagement of patient partners in patient-oriented research, and research participants. Now, for the purpose of this presentation, I'm just going to show one group. And somewhat surprising to me was actually so far the results have been quite similar. We expected there may be different barriers, both to identification and engagement of these two groups, but so far there's been a lot more similarity than difference. So this is the same question that you all answered in the last poll. You can see the results are very similar. So which groups are often underrepresented? And really, I think the take-home message is all of them. We need to do better, right? There is some variation. We see in particular a need for those with disabilities, Indigenous populations, but really, I think there's a lot of room for improvement. So the next is, what strategies have you used to improve recruitment of research participants from these historically underrepresented groups? And I think there's a couple points here. So one is that we're seeing financial compensation relatively high. I think if we asked this even a few years ago, it would be much lower. So I kind of see that as a positive, that we're seeing the importance of appropriate incentives to participation. However, I also wanted to highlight community champions. Although it was mentioned by a number, hasn't been used that often. And I think Quantrella will probably echo the importance of this group. And maybe that's a gap that we could address. Next is, how useful are the following methods for recruitment and engagement? And I've highlighted a few that those who responded deemed very useful. So in-person, word of mouth, and digital. And then as far as which digital methods, it seemed to be largely Facebook, which we've heard a few times, as well as online mother groups. Do you think also important to note the green bars are those who haven't tried? So there's also lots of things researchers and groups haven't tried. So I don't think we can imply that they necessarily don't work, but maybe we just don't know yet. Next is a little bit about settings. So clearly we're utilizing medical offices and community schools, services, and agencies. All of the other than health classes are rarely used. So again, whether that is a good avenue for recruitment and engagement or not, I think the jury's still out. But clearly the other places are where most of this is taking place. Then we asked about the top 3 challenges for recruiting from historically underrepresented groups. And a few really kind of bubbled up to the surface. So one is language barriers. And I think not only is it language, but it's also the type of language. So is it lay language? How much reading, writing, how complex? Jargon, technical and medical terminology, as well as what someone's first language might be. Lack of time. I think this is always a consideration in research, but of course, when we're talking about during childbirth, immediately postpartum, there are particular time constraints that we have to think about. Lack of trust. This is huge for recruitment to these groups. And then also childcare and parenting responsibilities, which would be more specific to this patient population. So again, I'll just share the QR code for those of you who want to take a look at the survey and fill it out. And I think next I'm going to pass over to you, Quantrella. Yeah.
Awesome. Thank you so much. So I just wanted to give you guys a highlight of what we did in the Putting Patients First workshop that we did, and give you just some, again, preliminary results of what we got for the feedback. So again, some of these questions are going to be very similar, right? So again, best methods for recruitment of patient partners. And so again, the thing that really surprised me was that in-person methods was the main way. It was one of the main ways people thought were the best methods of recruitment. And of course, you can see here that these in-person methods they range widely. So community groups and meetings and peer-to-peer shared experience, locations that are frequented by target groups, and collaborations with patient advocates and community partners. So if you look at a lot of these, they're all community centered and focused. And for me personally, as a researcher, I have found this to be echoed when I talk to people, when I speak to people, especially in how they would like to receive information, how they would like to be approached. It is almost always in a community fashion. So that is something that is like, a very glaring method that I would hope that we would just focus in on and not overlook. Community is very important. Secondly, digital methods. So, obviously during COVID, we were very limited on being able to use the community reach method. So a lot of things were shifted to digital. And interestingly enough, now that things are starting to kind of go back to in-person methods, people still also like to have the option of this digital method. So social media, Marian talked about Facebook, same thing here, the same group, you're seeing these methods being echoed in several places. So social media, it allows for you to get a deeper reach, a larger reach. Facebook groups, an in-app contact feature. And I really like that because now we're seeing the birth of apps that are specifically targeted toward patient partners and specific groups. And so now having those apps that are kind of coming out, and a contact feature in those apps would allow for people who need that information to be able to get it in a readily accessible way. SMS, I know that is, we're not as much text message people anymore, but what happens here is when we talk about time frame, especially when people are just, getting back home or trying to return back to what might be a normal life for them after having a baby. Sometimes they're not going to be on Facebook, they're going to be taking care of an infant. So sometimes you have to get really creative. And so going back to, text messages might be helpful as well. And also in older pregnant individuals, text message is easier than email because I know I wasn't checking my emails after having my children. Next slide, please. So now we're looking at the challenges. What challenges are faced in recruitment of patient partners from this group? So again, we're looking at language. We want to make sure we have appropriate language. And some of the work that I do is in health literacy as well. So we're trying to make sure that when we are engaging and trying to recruit people, that we use language that not only is appropriate for the study and appropriate for what we're trying to measure, but we want to make sure that people are understanding what's being asked of them as well. Lack of diversity in research teams. I mean, that's a huge one, guys. I mean, I think about the fact that when I was going through my training program, that there weren't really other researchers that looked like me in my cohort. And so especially working with underrepresented groups, you want to be sure that your research team really has representatives from sometimes those same groups that you're trying to reach. Another challenge that came out was lack of trust, research fatigue, negative experiences with research or health system. That is, again, that kind of goes hand in hand with the lack of diversity on research teams. When patient partners don't feel like they can trust the people that are coming to, engage in research with them. You want to be able to establish a foundation of trust, or else, you really are shutting yourself down before you get started. Also research fatigue, on the flip side of that is constantly draining the community, constantly going back to tap for more information and more information. A lot of times we can exhaust those resources. Time constraints and burden of participation. Again, when we're looking at recruitment, we want to make every part of our research as easy and as we don't want to put undue burden on the participants. We want them to feel comfortable. We want them to feel safe. And time constraints and burden of participation is sometimes an overlooked challenge as well. So for example, heavy reading, especially in populations where maybe there may be low literacy, some of the lower income populations, we want to be sure that we are projecting information in a way that allows for everyone to get the information the way they best receive it. Technical challenges. I can't imagine trying to recruit participants where there's no internet, there's no electricity. There are situations where this is a very big problem. And again, we have to take into account that those things exist as well, especially the cost of internet. Distance and time travel. When we're looking at having participants come to a center or come to a specific place in order to participate, we must also take that into consideration. And the challenge to identify community gatekeepers, that can also be a huge barrier because sometimes those gatekeepers aren't readily accessible, or it's hard to find out who they are. So again, just doing a little due diligence in trying to earn their trust. And then the last challenge here that we mentioned was the lack of connection with the health system. Sometimes we have individuals who are completely outside of a health system, no connection at all, and then looking back at time and distance of travel. So those things are huge challenges that we saw from the responses. Next slide, please. So now that we looked at the challenges, we wanted to also identify strategies that could be used to improve recruitment. Okay, so now we found out, okay, what are some of the problems? Now we want to also provide some solutions to help us address those problems. So we want to allow time to build relationships and trust. We saw that a challenge and a barrier was trust. So now we know we need to allow time for that trust to be built. And always going in with the perspective and the utmost respect for our participants. Again, diverse research teams, we found that it was a challenge, but now that we know it's a challenge, what can we do to ensure that we have diverse research teams, both on the side of, there being a large pool of qualified people that we can bring on our teams, but also for those of us who are already at the table. How can we speak up, and how can we make sure that that is something that we champion on our side of the table as well? Texting preferred to calling, setting up there are those mass text systems, right? So we can get this information and literally shoot out a text really quickly to a large group of people. In person. So having these in-person gatherings, right, will help with people who are looking for that community aspect, who are looking for that connection. But in order to do that, we definitely have to be sure to remove any of those travel, distance, and cost barriers, because again, we want to make participation not a burden, but something that is a benefit for those who would participate. And always creating a safe space. So where is a place that we can have participants come in person where they feel safe? Again, keeping materials simple, visual aids, lay language, using language that is not heavily medically based. Because again, we're looking at populations that are already vulnerable. So chances are they are not going to be using this language in everyday life. So developing connections, we want to make sure that we're engaging early, that participants are really part of the process from the beginning, not just kind of as an afterthought, bringing them at the end, but allowing them to have access and full participation from all stages. Again, those champions and gatekeepers are so super important because they already have established trust in these communities. And we're kind of seen as the outsiders. So we want to be sure that we get those champions and gatekeepers, get their trust as well. And then we can almost kind of leverage that trust as a way to connect to those communities in a more meaningful way. Making sure that we check in regularly. Sometimes participants will sign up and they will participate, but we won't see them because there's no touch point. There's just, once they sign up, they're in this, never ending chasm of, data, and then they just kind of disappear. So being sure that we're going back and we're checking regularly, that we're touching these individuals, right? They're not just data points, they are people. Culturally appropriate material in relevant languages. And I think this is actually connected to having diverse research teams, because sometimes you can have an intent, right, to be culturally appropriate, but a lot of times, unless you are maybe close in proximity to that community or a part of that community, it is hard for you to develop culturally appropriate materials. It really is. So having those diverse research teams will provide an extra layer of protection in that area. Because if something doesn't quite seem right, you have someone on your team that can wave a flag and say, hey, this doesn't sound quite right. So definitely having student volunteers as resources for translation, that's a part of your diverse research team. That is a strength for any research group. And then we want to highlight the value to the community and demonstrate potential benefit. We always want to be sure that the patient, that the participant is seeing the overall benefit in their participation. Because if they're not benefiting from it, then why are they there? So throughout the time that we have them, we have to continuously demonstrate the benefit. And sometimes, y'all, while we're in the process, we may find that something is not beneficial for that patient partner or for that participant. And while we're constantly trying to give them the benefits, and we find that it's not beneficial, then we can change course to make sure that it is. Appropriate incentives. I love this one because like Marianne mentioned earlier, incentives was a very large part of strategies to help improve recruitment. And not only just providing the incentive, right? And for myself as a researcher, I've always been taught you don't want to coerce anyone into participation. But again, going back to benefit, how is this going to benefit the person that's participating? And so not just giving incentives just to give them, but appropriate incentives. Maybe money is not an appropriate incentive. Maybe childcare may be more beneficial. And sometimes maybe money might be beneficial, but maybe a gift card is more beneficial, right? So you're allowing for incentives that will both bring a sense of honor to your participants, a sense of benefit to your participants, but also, again, going back to demonstrating respect for them as well. So next slide, please. I think that's the end of my part. Thank you so much.
Thanks, Quantrella. That was excellent. So I think now we've got still a good chunk of time to hopefully open it back up. And we have a few discussion questions already, and they'll look very similar to the things that you've already seen us present. But I would also just like to open it up generally if there's any questions. And also based on the feedback of who's attending, I'd be curious to know if people think the same barriers exist, as well as strategies if their research or work is in a different patient population. So if we're not thinking about the perinatal period, where might some of those changes be? That's another thing that I'd be curious about, and kind of Quantrella alluded to, but also how do we pivot with the changes that have been required for COVID? So is that going to, increase barriers? But I think it also maybe has decreased some barriers. Like I think it has had a bit of an effect on both ends, and I'd be happy to hear anyone's thoughts.
Hi, that was really fantastic. And this is amazing work that you guys are doing. I'm really excited to see it all coming together. I don't know if I have a question so much, but just I can make an observation. I did recruit patient partners for a steering committee at Children's Hospital over COVID. And I actually found that doing things virtually was beneficial because it reduced barriers to participation. These were patient partners who had recently been patients at Children's, or they're more the adolescent group. But the incentives is important, and I do really agree with that. But one of the things that I've come up against, and I'd be interested to hear if people have had similar experience and have any solutions, is that we are providing an honorarium for participation to respect the time and commitment that it takes to participate as a patient partner. And I think that's very important, but I've had a lot of trouble paying that through PHSA because they want me to estimate how much time it's going to take in advance and just have one payment, and that's not really reasonable. Or they have to be hired as almost like a consultant. And so I've been struggling a bit with how to manage some of those financial rules that get in the way of actually providing incentives effectively.
Mm-hmm. That's such a great point, Beth, and certainly had the same challenges also working even through UBC as well, like having to set people up as consultants, and then, delays of electronic fund transfer. And what if you don't have a bank account? And I think one approach in some cases has been gift cards, but in some populations, that's not the best approach. And often in those cases, cash is sometimes the best. And we might have to do our little workarounds where, you provide the cash and then submit for reimbursement. But maybe this is an opportunity for us to use this as a bit of a advocacy point to some of those institutions of the importance of these, especially when we're talking about relatively small monetary amounts. Like usually these are like under $100 per patient, to having more flexibility. Consuelo, did you want to add anything to that?
No, I totally agree. And a lot of times people are looking for numbers. Is there a way maybe you can show, well, these are the level of participation, this is percent of participation we had when maybe we weren't able to give incentives, or when we gave these types of incentives based on or compared to this is the percentage of participation when we had better incentives, or when we were able to give incentives. And sometimes making the case, looking at the comparison, can also help show, funders that, hey, maybe this is working. Maybe this is an effective method of recruitment for participation.
Yeah,
I'm going to jump in with a question while other people think of it. And thank you for saying something about childcare, because that was going to be one of my questions. Is in addition to compensation, providing, the same way we would pay for people's parking costs, paying for childcare costs seems like a really sensible thing to do. But one of the things we've talked about a lot when I've been in groups doing public deliberation, trying to get a diverse audience, is really thinking about the time of day or day of week we're asking people to engage. And I just wonder with this population, because we tend to think like evenings or weekends might be good, but I wonder if evenings are actually desirable for new mothers. So just any kind of comment you have on that would be really, really helpful.
Yeah, that's a great point. Consuelo, do you want to go first on that, or I feel like you probably?
Sure, I'll be happy to. I am a mother of 3, and the evenings are not a good time, especially, if you have a newborn, you're talking about, postnatally, like immediately postnatally, taking into account that the mom is still recovering. There's so many things to take into account. I think possibly doing a poll, if possible, to see like, what are your best times? When are your kids napping? Something to kind of ascertain what is a good time for moms. Evenings typically are not the greatest ones, especially if they don't have support with them. And if they have multiple children, evenings can be quite difficult to squeeze in, but usually middle of the day or maybe mornings, because they're probably already awake, are from my experience, what were good times for us.
Mm-hmm. And I think also Quentin and I are involved in another project where this is the exact issue we're coming up against. We have a patient advisory group and it's postpartum group. Some have returned to work, some have not. That also then is another thing, right? Like juggling your workday as well. And it actually isn't possible to get everyone together at the same time. So I think there can be a few approaches. I mean, you can use that as part of your kind of screening for your partners a little bit. But if you're really trying to get diversity and then that, makes some people ineligible, that doesn't work. So we've tried to do a few things. We've recorded, of course, all our sessions so people can watch them if they can't attend, provide feedback. Then we've also provided some like open times. So, okay, our session is tomorrow at 11, but if you can't join, here are 2 or 3 other times where we're just going to be on Zoom with it open, join, ask questions. Sometimes there's a few people who join, sometimes it's one, sometimes it's none, and also allow by email. So I think allowing flexibility and like having realistic expectations is key. But we also need to recognize that a lot of these strategies are putting the burden back on the researcher. It shouldn't be on the patient, but also the researcher has lots of burdens that they need to manage. So thinking about that when you're setting out your plan, and maybe that means being a little bit less ambitious with what you can achieve or the number of meetings. But I think, I would err on the side of doing it well, but doing less. So any other comments or?
I'll make a general statement and then I'll ask about a specific technology. I do patient research on people just in health and wellness more generally. And I would say not on pregnant people, but the recruitment challenges are very similar, right? So finding that time of the day, time of the week, and when you can get together. So I think that it must just be a people problem of how to put your study together with when they're available to give you that information. But if you work through them and look for those times, it's wonderful when you find them. Finding the champions are really important, but really hard because they're often very knowledgeable and overworked. But finding ways of what the value is to those champions often then flip them very quickly. So once they understand what you're trying to do and what the ask is of them, right? So you're just going to promote it into this network, then they're often very helpful, right? They're because there are so many demands on their times because they are usually key influencers in these communities, but everybody is throwing stuff at them, right? But if you find that value proposition of why they can help you and why that's really helpful, they'll do it for you pretty quickly, right? So, but yeah, the recruiting people and getting their data and finding all those time slices are the same. And social media is better for some groups and text is better for other people. One other technology that you didn't mention is chat, which I have had good success with in these communities. So the chat tool is kind of in between Facebook and the text message, right? And it can be recorded and it's pretty active. And so you can configure it to keep a record. So if you need it as a researcher, or you can say, nope, I'm going to throw it away. It's only during our session. But that is really quite useful social media tool that you might think about. Mm-hmm. Have you thought about that tool and whether you would use that?
Yeah, so you're thinking about the chat embedded within other social media platforms. Is that what you're referring to? Yeah.
Yes.
Yeah, absolutely. Yeah, no, I think that's a great point. And I think it also speaks to the importance of doing some of this kind of landscaping often, because it's also a landscape that's changing, right? Like I'm wondering, Facebook keeps coming up. Maybe that will stay forever, but I suspect there may be a shift over time to some of these others, like, the chat function for sure. I think it allows a bit more of a dialogue as well, right?
Yes. And it can be almost live, right? And Facebook has still got the most users, right? So volume of users will still be important. But these other communities, and certainly the in-apps are happening, but just through browsers as well as different platforms are starting and people are sharing their information. They're happy to go into these other applications and share and talk. And Google has introduced chat now, I noticed. And Microsoft in their MS Teams has chat, of course. So they're all kind of absorbing this functionality, and it'll begin to shift. But if you do that configuration of, okay, this set of social media is where I'm going to find my people and connect with those patient partners, then I think recruiting people and getting really good quality answers will be much better. It'll be easier, and you'll have greater information.
Yeah, absolutely. It's a great point. Thank you. Control, anything you wanted to add to that, or any other comments?
Yeah, I think that is a great suggestion. I've seen people use that for like community management and, staying in touch with their community. So there's such great value there. I've not ever seen it done with patient-centered research, but I think it would be a great tool to use. We talked a little bit about how we don't want people to just sign up and we never see them or talk to them or touch them again. So that would be an excellent way to keep up with them, to make sure that they're still being heard throughout the process. So thank you so much, Barb, for that. That was great.
No problem. I'm trying to build from the business system side, those sorts of functionalities. But what the challenge is always is finding you guys in your studies, right? But I think it's these networks of people who come together and say, you know what, we can help one another. So I'm trying to build from the system side and say, okay, I'm going to make these some available. Who wants to use these sorts of things, right? But let's keep sharing these sorts of tools and studies.
Fabulous. Thank you. And I think both those points also get back to the importance of having the right people on your team. And like by right people, I mean, diverse people, diverse backgrounds, interdisciplinary, culturally, ethnically, in all ways, age, experience. And they also have access to different communities. Your community champions can be within your team too, right?
Yes.
And I think that's been one of the huge barriers we see coming up, is this lack of connection and trust in champions. And if we had more diverse teams, I think we would see that a lot less.
Yes, absolutely.
Great. Thank you. Any other questions?
I just had a question. I noticed with the survey, it was interesting. There's a bunch of, I guess, root technologies that people really didn't report any experience using, like bus and television and stuff, which probably have some utility. I'm just wondering if you have any plans or ways to try to reach out to maybe people who have used those routes to kind of learn what worked for them and whether this might work as a strategy for recruiting more diverse patients.
Yeah, it's an interesting thing that came up. I mean, for the survey, we tried to look at other surveys that have been done and other research to get an idea of what kind of the various categories that we should ask about are. There's quite a number that haven't come up. Some probably because that haven't been used. Some probably because they're not that useful, but some maybe because people do what they do over and over, right? We get into like kind of our systems and don't always have a lot of variety in how we approach it. I think the radio and television one thing that might be interesting is to think about also podcasts. And actually, Stephanie and your group, you guys have a patient-led podcast, health podcast, and it'd be interesting probably even to connect with you guys and think like, how is that outreach going? And is that really an avenue or a method? Because I think that could be a possibility. Controller, do you want to add anything else to that or any other thoughts?
Yeah, and I also wanted to say that, also some of these answers are based on the population that's answering the question, right? So when I looked at, for instance, the one that was really, really high that said the area that we hadn't tried yet was like faith areas, I was like, wow, that maybe the first thing I thought about was, I wonder how many people of color answered. Because generally speaking, people of color are extremely connected to their faith-based communities, their faith-based institutions. So, also looking at that graph in terms of maybe who is answering the questions, right? So looking at the diversity of the respondents in taking into account those differences in what those responses could also be. So maybe people haven't tried it, but also looking at, okay, well, who exactly are we talking to, or what responses are we looking at, and what populations?
That's such an important point, Quintrilla, and for the kind of sake of time, I didn't include in the slides some of that information, but it's a huge gap. Like I can share that, and I'm happy to share with anyone who's interested of who the respondents have been so far. And you're right, they do still come from, I mean, we have some variety across urban and rural and, various categories, but especially in the racial and ethnic groups there's not as much. And so I think specifically on that one, their point is very well taken. And this is why we're hoping with a few methods, right? With this project, we can get a better understanding and a better picture. And in particular, with having more in-depth conversations with maybe some people who've been missed, particularly in things like the survey. So some interviews and focus groups, and really get to that. And again, I mean, I kind of reiterating, echoing the same point, but diverse teams, if you had that, you wouldn't be missing those things, right?
Yeah, that'll be interesting to hear the results from that, I think, because the in-depth interviews, you probably could get a lot more insight on this, because you're right, exactly. Without the diverse teams asking the questions sometimes, or answering the questions, it's just a cycle.
Exactly. Thanks, Stephanie. Any other comments or questions? And maybe I'll just mention that we will share, of course, the link to the survey. And I think it was shared in the chat. And also for the interviews and focus groups, as I mentioned, we have some medical students who are taking that on over the next few weeks. And we have reached out to a number of groups and scheduled those. But if you either are interested in participating or know someone who would be a great participant and have good insight, we'd be very keen to connect with them and talk more. And in the survey, we also provide an opportunity to leave your contact so we can follow up and ask further questions and get some more detail. So
can I ask a question?
Of course. We have an in-person with me question.
I'm curious, I guess, in how you're going about the recruitment for this study. Are you noticing like alignment or any dissonance between the responses of successful recruitment strategies and what you've been doing right now currently to reach out to people to get their feedback on that exact issue?
So that's an interesting question. So the way we've reached out to respondents so far, does that reflect their responses? Is that the question?
Yeah.
That's a good question. I have to think about that. I mean, a little bit. Of course, most of the data so far has been from more of these kind of traditional methods, like these virtual / in-person events and surveys. So maybe we'll have a slightly different answer after like the focus groups and interviews, which have been more like through personal connections. I also think there is a bit of a bias, of course, in some of the people who respond and who are at these events. These are people who think this is an important topic, they're engaged, they're interested. So they're more likely, I think, to have tried other methods or considered other methods and also identify this as a concern in the work that they're doing. So, but it's a good question. I might need to give it a little more thought too. Controller, do you have anything else you want to mention or add to that? No? Do you have any like suspicions that they would be the same or different?
I'm not sure what my hypothesis is. I suppose I wonder if we're in that situation of almost like, I don't know, in an echo chamber. Yeah, of receiving the information that people have found helpful when we're searching for that information via that strategy. You know, and we're using the same strategies as the people around us and the people who are responding or working in similar spheres.
Absolutely. And I mean, and again, that was one of the challenges that we identified, of course, early on. Okay, we want to get more information about what are the barriers and how we can better address them. But how do we like find out what those are? How do we reach these people we can't reach? So we've been trying some of the methods we've obviously been using in the past. And then also this is why, and some of our team members, many of whom are here today, really stress the importance of having those more intensive conversations with a few representatives of those communities to get that information. Because you're not going to get the hardly reached by trying to reach them the same way you've been trying to reach them, right? Yeah. Thank you. That's very important point. Excellent. Was there a question in the chat?
Yeah.
Oh, Consuela, yeah.
Yeah, I was going to say, I think Kim put a question in the chat.
Any comment on combined?
It's just about your experience with hybrid, trying to combine the in-person and the online, and whether you've tried it or people are receptive.
Yeah, so as far as engaging people through both methods is what you're thinking. Yeah, I mean, so most of our outreach, I'm trying to just think that if this is true, has still been online. I mean, and part of that obviously reflects it having been all throughout the COVID period. So there hasn't been a lot of opportunity for in-person kind of like recruitment or engagement. And even we were hoping the conference that was going to be in person, and then we were going to get to connect with some people, and then it ended up being kind of right at the Omicron height and moved virtual. So yeah, so we haven't actually had a lot of opportunity, but I suspect it would be different. I don't know, Consuela, if other projects or approaches, if you have a comment on that as far as using both or comparison.
I think actually using both is really the best of both worlds, really. And if you have the bandwidth and the technology where you can do both, I absolutely champion doing both, because again, you will get those who are physically able to come. You will also get those who are not physically able to come. You will get those who are comfortable coming. You will get those who are not comfortable coming in person. So offering a hybrid approach, I think, is really going to always be the best of both worlds. If that is something that you are capable of doing for your research and for your recruitment.
Mm-hmm. Yeah, great. I don't see any other hands or questions, and I think we have a couple minutes left. Should I pass it back over to you, Kim, at this point?
Yeah, I didn't see anything popping up, so I will just say thank you so much to both you, Mariana, and you, Consuela, for an excellent, engaging session, and to all of you for joining us today. So we'll be continuing with our Health After 2020 dialogue series in the fall, and invitation to those sessions will be sent to you by email. I would encourage you to sign up for the UBC Health newsletter so you're aware of other UBC Health events and opportunities. And with that, I will say thank you again for attending today, and have a good rest of your day and rest of your week.